History asserts that Egyptians loved challenges, built pyramids and temples, dig the Suez Canal in 1 year, and accomplished achievements that would last forever. LCC issued orders to the government to treat 1 million Egyptians from this serious disease and to specify a part of the resources of Tahyamis Fund to treat them for free.
بحلم وهم بيحلموا معايا إن إحنا ننهي المرض ده في مصر. فيا ترى مستعدين ولا عايز 1,000,000 جرعة للفيروس سي بتكلفة مالية غير التكلفة المالية اللي انتوا بتبيعوا بيها داخل مصر.
Let me mention that all the efforts were concerned, worked together under the leadership of our President Abdel Fattah al-Sisi in order to eradicate this disease that showed very wide prevalence in the Egyptians.
The government treated 1.4 million citizens with the cost of 3.6 billion Egyptian pounds. Tahyamis Fund contributed with 200 million Egyptian pounds. The healing rates using the Egyptian medications exceeded 90%. The word of President Abdel Fattah al-Sisi about this accursed disease. Engineer Sharif Ismail, President Prime Minister, adopted achieving this goal in the agenda of the government, which allocated the required budget to achieve this objective. We can also show Engineer Sharif Ismail in the ministerial meetings or during a meeting. The Ministry of Health began its war against virus C after the information showed that this dangerous disease is destroying the livers of Egyptians and that Egypt is one of the countries with the highest rates of infection. Although the government established the National Committee for the Control of Viral Hepatitis in 2006, the lack of funds and the scarcity of companies that produce medicines to treat the disease resulted in failing to accomplish the task until the number of patients in waiting lists in the last quarter of 2015 exceeded 350,000 patients.
We went through 3 lines. First, how to combat and finish our waiting list. The second, we are planning to go for the screening of the population to know people who do have this disease but they don't have a manifestation about it. And then the third item was the prevention and the infection control against such a disease. To eradicate or to finish this waiting list, we established a national strategy with treatment protocols and prevention program, awareness and media campaign. Our main challenge by the time was in the implementation of our eradication plan was the high prices of the medicines. This resulted for this long waiting list. Our effort started by negotiation directly with the multinational and the foreign companies to provide medicines to the Egyptian patient, but at a reasonable price. Then we start negotiating the local companies to manufacture the drug or the treatment in Egypt, and they started to manufacture the drug in Egypt.
The ministry celebrated this achievement at the pyramids with the attendance of Margaret Chan, World Health Organization Director. The words of Margaret Chan at the pyramids. The efforts exerted by the Egyptian Ministry of Health were redoubled and the treatment plans moved in a group of parallel routes.
Under the leadership of the Ministry of Health and Population, they have started negotiation to negotiate the price down. And the price has kept coming down. And now it is affordable. And so the government promised to make sure that every Egyptian has access to the treatment. But of course, now the government has a much better program, starting from prevention and to make sure people are tested and proper testing before they get treatment for hepatitis C. So this is a very successful public health project. And I want to congratulate you, Minister, for the excellent work.
The number of treatment units increased from 53 to 185 in 69 units at the expenses of the government, while there were only 26. These units follow the National Committee of the Control of Viral Hepatitis and distributed all over Egypt. There are 19 in Greater Cairo, 8 in Alexandria, 13 in Upper Egypt, 20 in the Delta, and 9 in the Suez Canal Zone. The number of units that are part of the health insurance system increased from 27 to reach 116 units. In a parallel route, the government encouraged local companies to produce medications for virus C.
We reduced the cost of treatment out of $700 per patient in 2014. It turned to become only $80 by the end of year 2015. This was the main keystone, with other standardized measures that enabled us to treat all the waiting list of patients with hepatitis C by the end of August 2016. And let's come to today. In October 2017, it is about 2 years or 1 year and 8 months, we have already treated 1.4 million patients with a total cost of 3.6 billion Egyptian pounds.
The government prepared a national plan to carry out the comprehensive field survey. In the 16th of August 2016, Prime Minister determined in his Decree number 2015 for the year 2016 that the first phase of the survey would include 6 categories of citizens to immediately search for patients and treat them. This included governmental hospitals' internal patients, students in the first year of university, governmental employees, inmates, citizens who desire to travel abroad, citizens who visit blood banks. The second phase of the national plan of the comprehensive survey targeted finding patients with this fatal virus in the villages of Upper Egypt in 2017.
In each month, we discover 16,000 patients. These 16,000 patients get their treatment. That's to say that we have now per year about 170,000 cases. Putting in mind that our population is about 100 million persons, this means that we have an incidence now of less than 1% patients with hepatitis C in Egypt. We didn't have our demographic survey that's going to be held within 2 months. I think the results of our demographic survey is going to give us new data about the prevalence of the hepatitis C in Egypt.
The number of villages was 1,279 until the 31st of August 2017. 2 million citizens were examined in these villages. 2018 will be dedicated to the citizens living in Lower Egypt. The political leadership of the country gave special attention to this campaign. On the 23rd of May, President Abdel Fattah al-Sisi gave orders to reach the international rates of examinations and treatment in 1 year. A plan was prepared to examine 30 million citizens in 1 year and treat infected patients with a total cost of $360 million. which is the Egyptian Ministry of Health continued implementing its strategy. Treatment and examinations were not the only tools used to combat the virus. The strategy was completed by activating the preventive measures to stop the prevalence of the disease through monitoring viral hepatitis through the units distributed all over Egypt. This is in addition to applying 0 dose of hepatitis vaccine for the newly born children against virus B and to specify 228 units to vaccinate those who are in contact with patients. This is besides identifying kidney dialysis devices that are specified for patients who are infected. The procedures of combating infection were implemented in health institutions through vaccinating the workers there and training them according to the national guide to combat infection. On the level of safe injection, an Egyptian strategy to develop safe injections in Egypt was initiated. The Egyptian government also gave special attention to establish self-destructive syringes factories. The safety of blood was reassured and the government made the best use of scientific and information research. This is in addition to raising the awareness of the community regarding the dangers of the disease. The national strategy Egypt initiated to combat virus C succeeded. Egypt accomplished a new achievement. Egypt was able, in a short period, to move from one of the countries with the highest rates of infection to one of the most successful countries in combating the disease. This achievement would not have been accomplished except for the presence of the political will that is well aware of the severity of the disease, the work plan that is based on correct information, the boldness to face dangers through taking fast and correct decisions, and the support of local and international organizations. Egypt defeats virus C.